Good evening, medical students. Today, we will be delving into the fascinating world of neurology and specifically exploring the intricate topic of hepatic encephalopathy. This condition involves a range of neurological dysfunctions that arise as a result of liver disease and dysfunction. By understanding the underlying mechanisms, we can develop effective strategies for prevention, management, and treatment. Hepatic encephalopathy is associated with an inflammatory response within the brain, referred to as neuroinflammation. This response is mediated by various inflammatory markers, including microglial activation and the release of pro-inflammatory cytokines. Neuroinflammation contributes to the disruption of neuronal function, ultimately leading to the characteristic neurological symptoms seen in hepatic encephalopathy. Research has shown that targeting neuroinflammation can potentially be a therapeutic strategy for the management of hepatic encephalopathy. By modulating the inflammatory response, it may be possible to alleviate symptoms and prevent further neurological damage. In recent years, significant advances have been made in identifying molecular targets for pharmacological intervention in hepatic encephalopathy. These targets include receptors, enzymes, and signaling pathways involved in neuronal function and inflammation. For instance, targeting the GABAergic system, which plays a crucial role in the regulation of neuronal excitability, has shown promise in ameliorating hepatic encephalopathy symptoms. Other potential targets include ion channels, glutamate receptors, and neuroinflammatory mediators. Developing drugs that specifically target these molecular pathways can potentially provide more targeted and effective treatment options for patients with hepatic encephalopathy. The gut-brain axis refers to the bidirectional communication between the gastrointestinal tract and the central nervous system. Dysfunction in this axis has been implicated in the pathogenesis of hepatic encephalopathy. In patients with liver disease, alterations in gut microbiota composition and function can lead to the production and accumulation of neurotoxic substances such as ammonia and bacterial metabolites. These substances can then cross the blood-brain barrier and disrupt normal brain function, contributing to the development of hepatic encephalopathy. Understanding the role of the gut-brain axis in hepatic encephalopathy opens up new avenues for therapeutic interventions. Modulating gut microbiota composition, reducing bacterial translocation, and targeting gut-derived toxins are potential strategies for managing this condition. Ammonia, a byproduct of protein metabolism and a waste product of the liver, plays a significant role in the pathogenesis of hepatic encephalopathy. In healthy individuals, ammonia is efficiently converted into urea and excreted by the liver. However, in liver disease, impaired liver function leads to increased levels of ammonia in the bloodstream. High levels of ammonia have toxic effects on the central nervous system. It disrupts neurotransmitter systems, impairs mitochondrial function, and induces astrocyte swelling, all contributing to neuronal dysfunction observed in hepatic encephalopathy. Targeting ammonia metabolism and reducing its neurotoxic effects is crucial for managing this condition. Neuroimaging techniques have provided valuable insights into the structural and functional alterations associated with hepatic encephalopathy. Magnetic resonance imaging, MRI, and functional MRI, fMRI, have been particularly useful in studying the brain changes in patients with this condition. MRI studies have demonstrated alterations in brain volume, especially the gray matter in regions involved in cognition and movement control. fMRI studies have revealed abnormal functional connectivity patterns and regional brain activation patterns, highlighting the underlying disturbances in neural networks. Neuroimaging plays an essential role in the diagnosis, monitoring, and understanding of hepatic encephalopathy. Continued research in this field may help identify biomarkers for early detection and track treatment response. Hepatic encephalopathy is characterized by abnormalities in various neurotransmitter systems. GABAergic and glutamatergic neurotransmission alterations are particularly well documented in this condition. GABAergic neurotransmission is impaired, leading to reduced inhibitory tone in the central nervous system. This imbalance contributes to the development of cognitive and behavioral symptoms seen in hepatic encephalopathy. Glutamate, on the other hand, is found to be elevated in the brain, further exacerbating neuronal excitotoxicity. Understanding these neurotransmitter alterations is crucial for developing targeted therapies that can restore the balance of inhibitory and excitatory neurotransmission in hepatic encephalopathy. Sleep disturbances are prevalent in patients with hepatic encephalopathy and can significantly impact their quality of life. These disturbances include altered sleep-wake cycles, daytime sleepiness, and abnormal rapid eye movement, REM, sleep patterns. Sleep abnormalities in hepatic encephalopathy are attributed to multiple factors, including alterations in neurotransmitter systems, circadian rhythm disruption, and systemic inflammation. Treating sleep disturbances is an important aspect of holistic management for patients with hepatic encephalopathy. Research into the mechanisms underlying sleep disturbances in this condition may lead to novel therapeutic approaches targeting sleep regulation. The gut microbiota, which refers to the community of microorganisms residing in the gastrointestinal tract, plays a fundamental role in hepatic encephalopathy. Dysbiosis, characterized by an imbalance in the gut microbiota composition, is commonly observed in patients with advanced liver disease. It is suggested that gut dysbiosis contributes to the production of neurotoxic substances, alteration of gut integrity, and systemic inflammation, all of which can affect brain function and exacerbate hepatic encephalopathy symptoms. Modulating the gut microbiota through dietary interventions, prebiotics, probiotics, or fecal microbiota transplantation shows promise as potential therapeutic strategies for hepatic encephalopathy. Neurophysiological changes in hepatic encephalopathy encompass a range of alterations in electrical activity and brain wave patterns. Electroencephalography, EEG, has been instrumental in the study of these changes. Patients with hepatic encephalopathy exhibit abnormal EEG patterns, including generalized slowing of brain waves, triphasic waves, and intermittent bursts of high-amplitude delta activity. These changes reflect the disruption of normal neuronal activity and can be used in the diagnosis and monitoring of hepatic encephalopathy. Understanding the neurophysiological changes helps clinicians assess the severity of the condition and guide treatment decisions. Hepatic encephalopathy is frequently associated with various degrees of neurocognitive impairments. These impairments can range from mild deficits in attention and executive function to severe confusion and coma. The exact mechanisms underlying neurocognitive impairments in hepatic encephalopathy are complex and multifactorial. They include alterations in neurotransmitter systems, toxic effects of ammonia and other neurotoxic factors, and the impact of systemic inflammation. Assessing neurocognitive function in patients with hepatic encephalopathy is crucial for both diagnosis and ongoing management. Interventions targeting neurocognitive impairments aim to improve patients' quality of life and functional ability. Advances in our understanding of the pathophysiology of hepatic encephalopathy have opened up avenues for the development of novel therapeutic targets. These targets aim to prevent and treat the underlying mechanisms driving this condition. Among the emerging therapeutic targets are antioxidant agents, neuroprotective agents, modulators of the gut-brain axis, and agents that promote ammonia detoxification. Additionally, immunomodulatory therapies and neuromodulation techniques show promise in managing hepatic encephalopathy and improving patient outcomes. Continued research in this area is essential for developing effective and targeted therapeutic strategies for hepatic encephalopathy. Predicting the prognosis and long-term outcomes of patients with hepatic encephalopathy is challenging but crucial for treatment decision-making. Several scoring systems have been developed to assess the severity and predict prognosis in this condition. The Model for End-Stage Liver Disease, MELD, score and the Westhaven criteria for hepatic encephalopathy grading are commonly used to evaluate patients' clinical status. These scores integrate various clinical and laboratory parameters to provide an objective assessment of disease severity. Refining and expanding these scoring systems could help clinicians predict long-term outcomes, guide therapeutic interventions, and optimize patient care in hepatic encephalopathy. In conclusion, hepatic encephalopathy is a complex neurological condition that requires a multidimensional approach for understanding and management. Our exploration of various topics has shed light on the role of neuroinflammation, molecular targets, gut-brain axis dysfunction, ammonia neurotoxicity, neuroimaging findings, neurotransmitter alterations, sleep disturbances, gut microbiota, neurophysiological changes, neurocognitive impairments, novel therapeutic targets, and predictive scoring systems in hepatic encephalopathy. By gaining a deep understanding of these aspects, we can work towards improving the management and outcomes of patients with hepatic encephalopathy. Continued research and collaboration in this field will pave the way for further advancements and interventions in this fascinating area of neuroscience. Thank you for your attention, and I look forward to our future explorations in neurology.